one of the questions, last I discussed, that's once again, what is that? Marks on the face, bangu, they call it in Kannada. One lady has asked, he has got bangu, and what is the remedy for that?
Okay, bangu. Okay, melasma. This is a very common problem and also a very difficult problem to treat in some individuals. And in a lot of individuals, we do see that this resolves completely on its own after about having existed for 20 to 25 years. So what is exactly happening in melasma or bangu? Well, the melanin producing cells, the melanocytes, only of the face are stimulated to a large extent. And this happens in genetically predisposed individuals, which means that an individual has a genetic makeup that makes this person develop this. It does not mean that the person's mother or father must have this. May have it, but not necessary. It's not hereditary, but it is genetic. So what's happening is, these cells are very easily stimulated. And what stimulates these pigment-producing cells on the face? Well, even a little bit of ultraviolet ray exposure, or even for about 5 minutes, can cause this pigmentation to worsen. And of course, the hormonal changes that a woman goes through during her entire lifetime will keep causing this melasma to, worsen progressively. And the same hormones are the ones which cause this melasma or bangu to have its onset during pregnancy, which is why it's also called the mask of pregnancy. So a lot of people have the onset of this problem during pregnancy. So it's the hormones which make treating this a little challenging. So what are the treatments available? Well, it goes without saying that one must use a sunscreen to prevent or at least slow down further aggravation of the problem. Apart from that, one can use depigmenting creams. There are various types of depigmenting creams. In fact, the most strong of all depigmenting creams is used to manage melasma. People use hydroquinone, people use tretinoin, and on top of that, people use steroids also to treat this. But since we're talking about it, there are a lot of over-the-counter medications available, which are just dispensed by the pharmacist. So you get these triple combinations, all these light creams, Go Light, Melalite. So all of these are steroid-based creams. So they give very quick results. But what are the side effects associated with these creams? Progressively, these steroids cause a thinning of the skin. The uppermost layer of the skin keeps getting thin. It becomes so thin that after a point, the blood vessels will be visible through the skin. And that is not reversible. And that's when I see these patients. So it becomes a 6 to 8 month long treatment for me to correct it. And they become addicted to it, not psychologically but physically. They cannot stop using this cream. Because the moment they stop using these creams, they will have acne breakouts. They would have never had acne in their entire lives. But the moment they stop these steroid creams, they develop acne. So, no matter how bad your melasma is, don't use any of these steroid creams that are available over the counter, because at the end of the day, melasma, if it's there, you can just use a concealer and at least deal with it. So, that's just one caveat that I wanted to share. So, what can be done for melasma? We can use depigmenting creams. Sunscreens must be used, that goes without saying. Usually, this is not sufficient. So, there is another medication that's being given. It's known as Tranexamic Acid. Now, this tablet medication is used to treat excessive bleeding during menstrual periods for women. And it is given at a very high dosage for this purpose, for the management of heavy menstrual bleeds. So, it was observed in these women that their melasma was clearing up. And then it was incorporated into our dermatology practice. And we give it at a very low dosage for about 6 months. And this is one of the best treatments for melasma. It doesn't work for everybody, for whoever, but for those it does work, it works very well. But if tranexamic acid is not working, we will have to resort to just using sunscreens and using probably concealers to conceal the melasma. Well, can we use lasers? Well, again, lasers are not the best treatment for melasma. Lasers have their use for other types of pigmentation, but melasma is not best treated by lasers.
Okay, that's nice, doctor. You have told what should not be done, because that's very important, and also what can be done. Thank you, doctor.